All right, today we're diving into a really big topic, Risperidone. This is one of those medications that's an absolute powerhouse in psychiatry. It's been a cornerstone treatment for some really serious conditions, but, and this is a big but, that power comes with some pretty significant trade-offs.
So, yeah, it's a powerful tool for the mind, for sure. But what's the catch? There's always a catch, right? That's really the core question we're going to tackle here. We're going to break down exactly what this medication is, how it works its magic, and, most importantly, that critical balancing act between all the good it can do and the risks that come with it. Okay, so here's the game plan. First, we'll cover the basics. What even is risperidone? Then we'll get into the cool science of how it actually works in the brain. After that, we'll look at what it's used for, how it's prescribed, and then, and this is super important, we'll dive deep into the risks and side effects. And we'll wrap it all up by talking about that balancing act of using it safely. All right, first things first. What exactly are we talking about when we say risperidone? Well, it belongs to a class of drugs called atypical antipsychotics. That sounds a little intense, right? So let's break down what that term actually means. So, an atypical antipsychotic, sometimes you'll hear it called a second-generation one, is basically a prescription med that works by tweaking the levels of key chemical messengers in the brain. Our neurotransmitters. They're considered a newer, more modern class of these drugs, designed to be a bit more precise than the older first-generation ones. Okay, so how does this stuff actually do what it does? I love this analogy. Think of your brain's communication system like a super complex sound mixing board. Risperidone isn't just yanking one fader all the way down. Nope, it's much more subtle. It's about fine-tuning a couple of really crucial channels to get the sound just right. And here's where that dual action mechanism comes into play. It's a tale of two neurotransmitters. On one hand, it blocks dopamine. See, too much dopamine activity is often linked to things like hallucinations and delusions. So blocking it is like turning down the volume on all that disruptive noise. But, and this is what makes it atypical, it also blocks certain serotonin receptors. This is the fine-tuning part of the analogy. It helps with what are called negative symptoms, like social withdrawal, and this is a huge deal, it helps reduce some of those really rough motor side effects that were common with the older drugs. Okay, so with that clever 1-2 punch on dopamine and serotonin, what is risperidone actually used to treat? Well, its uses fall into two main buckets, the official FDA-approved uses and then the off-label uses, which is how doctors might use it in practice. So here are the big ones that have the official FDA stamp of approval. First, schizophrenia, both for managing those acute intense episodes and for long-term maintenance to keep things stable. Then you've got bipolar disorder, where it's used to control manic or mixed episodes and, again, for long-term treatment. And a very specific one, it's approved for treating severe irritability, aggression, and self-injury in kids and teens with autistic disorder, a very targeted and important use. But that's not the whole story. You'll often hear the term off-label, which just means doctors use their clinical judgment to prescribe a drug for something it wasn't officially approved for. With risperidone, common off-label uses include managing agitation in people with dementia. And believe me, we'll circle back to the huge with caution sticker on that one. It's also used for things like PTSD or even as a helper drug when antidepressants just aren't cutting it for major depression. All right, so we know what it is and what it's for. Let's get practical. How do people actually take it? Because the how, the dosing and administration, is absolutely critical for using it safely. You've got a few options here. There are the regular pills you swallow. Then there are these cool orally disintegrating tablets that just melt on your tongue, which is great for some people. But the real game changer for many is the long-acting injection. A healthcare provider gives it, usually every 2 weeks, and it's a huge help for folks who might have trouble remembering to take a pill every single day. It just ensures a steady, consistent level of the medication in their system. And when it comes to dosing, there is one golden rule, a mantra, really. Start low, go slow. I mean, this is so important. A doctor will always start with a super small dose and then inch it up very, very gradually. The whole point is to find the sweet spot, the absolute lowest dose that gets the job done and controls symptoms. Why? Because it's the single best way to minimize the risk of side effects. And that brings us to what is honestly the most critical part of this whole discussion, the risks. If risperidone is this powerful tool, then think of this next part as the giant, flashing, bold print warning label that comes with it. We have to talk about the side effects. Let's break these down into 3 big buckets to make it easier to understand. First up, metabolic issues. This is a huge one for this type of medication. We're talking about things like significant weight gain and increases in blood sugar and cholesterol. That's why anyone on this has to get regular blood work to catch potential problems like diabetes before they start. Second, hormonal changes. It can raise levels of a hormone called prolactin, which can cause some pretty noticeable physical changes. And third, neurological side effects. This group is often called EPS and includes things like a really awful inner restlessness. It's called akathisia, or muscle stiffness and tremors that can look a lot like Parkinson's disease. Now we have to talk about the most serious warning the FDA can issue. It's called a black box warning, and it's right there on the label. It says very clearly that when this drug is used in elderly patients who have dementia-related psychosis, it is linked to a higher risk of stroke and even death. It's a really stark reminder of why this drug has to be used with extreme caution, especially in that vulnerable group. Then there's something called tardive dyskinesia, or TD for short. This is a really serious condition involving involuntary, repetitive movements. You might see it as grimacing, or tongue movements, or smacking lips. And the scariest part, the part we really need to focus on, is that it can be irreversible. Even after stopping the medication, the movements can continue. And the risk goes up the longer you're on the drug. And one more, and this one is a big deal. It's called neuroleptic malignant syndrome, or NMS. Now, it is rare, which is good, but it is a life-threatening medical emergency. We're talking a sudden spike in fever, super rigid muscles, confusion. It's a full-blown crisis that requires someone to get to the hospital immediately. It's a small risk, but a critical one that everyone needs to know about. Okay, wow. So after hearing all of that, you're probably thinking, how on earth do people take this safely? Well, it all comes down to what we've been calling the balancing act. It's this constant process of working to get the maximum benefit from the drug while doing everything possible to minimize all those risks. And here's how that balancing act works in practice. These are the non-negotiables. First, you have to do regular monitoring of weight, blood sugar, and lipids. It's essential. Second, you can never just stop taking it cold turkey. The dose has to be tapered down slowly and carefully with a doctor's guidance. And finally, the doctor needs to know about every single other thing you're taking, other prescriptions, supplements, you name it, because the risk of interactions is very real. So let's wrap this all up. What's the bottom line? Risperidone is, without a doubt, a profoundly effective medication. It has literally changed lives for the better, but its power demands respect. It's not a drug you can just set and forget. It requires ongoing, careful teamwork between a patient and their doctor to navigate that serious side effect profile and make sure, at every step, that the good it's doing still outweighs the potential harm. And that really leaves us with a bigger question to chew on, doesn't it? When we have these incredibly powerful tools in medicine, how do we strike that perfect balance? How do we harness all that power for good while also respecting the precautions that are needed to keep people safe? It's probably one of the biggest challenges in medicine today, and it's definitely something worth thinking about.